Hi, I'm Dr. Stephen Wangen, the founder of the IBS Treatment Center. I've been helping people recover from chronic digestive problems since 2005. And one of the most eye-opening truths I've learned along the way is this. The modern medical system doesn't primarily exist to help you get healthy. It exists to operate within and often cater to a multi-billion-dollar pharmaceutical system. This isn't a conspiracy theory. It's just how the system is structured. And if you've ever felt like your doctor is more focused on managing symptoms than solving your problem, there's a reason for that. Today, I want to look behind the curtain and show you how drug companies quietly but powerfully shape almost every part of your healthcare experience, especially when it comes to chronic conditions like IBS. Most people probably assume that drug companies play a small role in healthcare, creating medications when needed. But the truth is that pharmaceutical companies are woven into the very structure of the U.S. medical system and probably the worldwide medical system. And here's what that looks like. Number one, medical education is heavily influenced by big pharma. So from the moment a doctor enters training, nearly all of the curriculum is built around diagnosing disease and prescribing medications. And very little time is spent on things that you probably think are super important, things that I certainly think are super important, and they're these. Identifying root causes. And I know that that sounds hard to believe, but ask yourself, how many times have you been to the doctor and the doctor has not been able to tell you what is causing your problem? This happens all the time, all day long in every doctor office. The next thing, nutrition, something else they don't focus on. Immunology as it relates to food, the microbiome, environmental factors, preventive strategies. And I certainly think that all of those things should be at the forefront of what your doctor is learning, but they aren't. And students are trained, medical students are trained to see symptoms and then match them to a diagnosis and then select a drug. And that's not an accident. Pharma funds a tremendous amount of medical education and medical guidelines and continuing education. All right, the second part. Research is primarily driven by those who pay for the research, of course, right? And most clinical research is funded by the very companies who make the drugs being studied. So this means the conditions without profitable drugs rarely get meaningful research, of course. And solutions that don't involve medications get ignored. And that studies are designed to favor drug outcomes. And negative results, negative studies, they just go unpublished. And so when you wonder why there isn't more research on diet and the microbiome and food allergies and functional immunology, the answer is simple. No one stands to profit from the cure. So next, the treatment guidelines are built around pharmaceuticals, and doctors are required to follow standardized guidelines. And of course, there's a problem with that. These guidelines are built almost entirely around medications. And this means that no matter how many traditional GI docs that you visit with your IBS symptoms, they all have the same tools in their toolkit. And those are, and you might know what these are, right? These are antispasmodics, acid reducers, antibiotics, anti-inflammatories, antidepressants, motility changers, things that change motility in your gut, fiber supplements, and laxatives. And none of those address the cause of your problem, but they fit the model. And the model is find the symptom, match the drug, and move on. All right, so that was part one. This is part 2, why the system can't solve chronic illness. And pharmaceuticals, of course, have a legitimate place, especially for acute or emergency or surgical medicine, or just really slowing things down so you can implement all the real true causal issues. Now, but solving chronic illnesses like IBS and food intolerances and dysbiosis and Candida and even ulcerative colitis and Crohn's, those are root cause problems. And root cause medicine doesn't create billion-dollar drugs. Pharma can't profit from curing you. And companies make money on medications you take indefinitely. So if a treatment solves the problem, the revenue stops. So the system is designed around what? Maintenance, not resolution, symptom control, not root cause investigation, and lifetime customers, not recovered patients. And that's why you get this dichotomy in medicine where they kind of talk about solving the cause, but they never really do. And this is why patients often get told, oh, your labs look normal, or there's nothing wrong with you, or you'll need this medication, and they kind of hint it indefinitely or don't really use those words, but you realize, oh wow, I'm going to need this medication forever because what's the alternative? Or they say something like, IBS is something you just have to live with. And these phrases aren't a lack of intelligence. They're the result of a system that never taught your doctor how to actually fix the problem. So how does this affect people with IBS? Now, IBS is one of the clearest examples of pharmaceutical influence in action because, one, IBS has no profitable drug-based cure. So it gets very little research, and instead, drugs are approved to mask symptoms. So think about it. Antispasmodics, antidepressants, medications that simply slow down or speed up your intestines, all of those things are what are used in IBS medication. And two, the true causes aren't drug-friendly. And real causes often include things like food reactions, food allergies, food intolerances, microbiome imbalances, bacterial and fungal overgrowths, digestive deficiencies, immune activation in the gut, post-infectious sequela, things. These aren't treatable with a single blockbuster medication, so they're largely ignored. And three, patients get caught in a symptom management loop. So maybe you've had this experience. People go from doctor to doctor, but they get the same medications, the same tests, the same message, live with it. And that's where our clinic comes in. So this is how independent medicine breaks that cycle. At the IBS Treatment Center, we operate completely outside the influence of pharmaceutical companies. We don't accept any drug company money, and we do not allow pharmaceutical marketing or funding or incentives to shape what we do or how we practice. And I've had them reach out to me and I just ignore them because they don't have anything to offer me that's going to be helpful and cure my patients. So our recommendations are not influenced directly or indirectly by any company that profits from medications. And that independence is what allows us to do what the conventional system simply doesn't do. And that's identify and treat the actual root causes of your digestive problems. And so we can run the right tests and we investigate your immune system and we analyze your microbiome and we uncover the dietary triggers and we target the actual mechanism causing your symptoms. And we guarantee results. Where else can you get that? So this is why thousands of people from all over the US and the world have come to us, often after seeing multiple doctors who could only offer medications. Now, drug companies have shaped the healthcare system for decades, and not through some sinister plot, but through a structure that rewards medications over solutions. And if you're struggling with IBS or chronic digestive problems, it's critical to understand that. The system isn't failing you because you're the unusual case. Everyone is led to believe that they are unusual. It's failing you because it was never designed to solve chronic digestive problems in the first place. And if you're ready to actually get better and not just manage your symptoms, call us now at the IBS Treatment Center. Our number is 206-264-1111. And we help people just like you get their lives back every day, and we can help you too, no matter where you live. Thank you for watching. We create informative videos like this weekly. So if you enjoyed it, please help our channel by sharing a screenshot or the link to the video on Facebook or Instagram or your favorite social media. And be sure to tag me wherever you post and let me know what you liked about the video and what topics you'd like me to discuss in the future. If you visit our website at ibstreatmentcenter.com, we're currently offering a free ebook on how to beat IBS, so be sure to check that out. It's time to take control of your digestive problems and get your life back. I'd also appreciate it if you could subscribe to our channel here, like this video, and leave a comment or question below. I'll do my best to read and respond to all of them. Thank you, and until next time. Here we go.